I think if it's Mila's preference, we should. Because she's going to keep us on time. So for those of you who are on and for those of you who are joining, welcome. This is the Council on Linkages between Academia and Public Health Practice. My name is Amy Lee, and this is the first meeting that I'm chairing, so please be gentle. Anyway, we're going to be taking attendance, but Mila is going to be looking through the rolls, so you won't have to say anything, and she'll just make sure that she lets us know if we have quorum a little later. I do want to thank the Centers for Disease Control and Prevention's National Center for State, Tribal, Local, and Territorial Public Health Infrastructure and Workforce for providing the funding that supports this meeting and enabling our current council activities. So thank you so much. And again, welcome. Next slide.
Great. So thank you so much, Amy, for getting us started. I just have a couple of housekeeping items for everyone. Audio is available via your computer or your phone. We ask that you please keep yourself on mute when you are not speaking, but please feel free to have your video on, put comments or questions in the chat box, and to turn on your mic whenever you want to participate in the discussions. We are recording this meeting and we'll be using it both for note-taking purposes and we'll be sharing it publicly using the Council on Linkages website. If at any time during this meeting you have any issues with technology or audio, just any other questions, please feel free to put it in the chat or send me a direct chat. I'm Mila Arana /PHF webinars.
Thank you so much, Mila. And just to remind everyone, we do have at least one new member, what our mission for the Council on Linkages is. So it's to improve the performance of individuals and organizations within public health through a number of different activities. We do a lot of collaboration, public health education and training for public health professionals, and also advancing in innovative strategies. I know you can read the complete slide. Next slide. So this is an organization of 24 national organizations, plus our staff provided by the Public Health Foundation. And of course, we all focus on workforce development initiatives that will broadly benefit the public health and population health workforce. This is the agenda. So I know you can all read the agenda. Of course, we're going to approve minutes. We're going to follow up from a previous meeting discussion. We're going to ask for your help in supporting one of the initiatives that you had all voted on. And we're going to have a number of updates and topics, as you can read on the agenda. So we are going to turn to approval of the minutes from the June 24, 2024 meeting. And so I believe Mila has sent that out to everyone. Did anyone have any corrections to these minutes? And Mila, by the way, do we have a quorum?
Yes, we're good.
Yay, thank you so much. And thank you all so much for being present. So anybody have any corrections?
No corrections, Madam Chair, but I would move approval of the meeting minutes from June 24th, 2024, with full acknowledgement of the thoroughness of those minutes for us.
Thank you so much, Gary. You always are able to look at the minutes, and so thank you so much for motioning for the approval. Could I have a second?
Don Weisman seconds.
Thank you so much. All those in favor, unmute and say aye.
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 Any?
Aye.
Thank you. Any opposed? And any abstentions? Okay, thank you. Next, I'm going to hand it over to Ron. Ron is going to lead a discussion about the vice chair position.
Thank you so much, Amy. And great job starting us off as your first chair meeting. During the last council meeting, a few members suggested that it may be useful to create a vice chair or chair-elect position for the council. Some others expressed that they didn't see a need for an additional leadership position. After a good bit of thought internally, we have molded over a good bit. As council staff, we also don't necessarily see a need for that additional leadership position. However, recognizing that this may be the direction the council wishes to go in, we thought it would be good for us to think through what this position might be. And we believe that a vice chair position would be the way to go over a formal chair-elect position. The criteria for serving as vice chair would be the same as that for the position of chair and would be elected on a 2-year cycle, again, the same as the chair. The vice chair would fill in for the chair in the case of absence at a council meeting or other obligation. And while the vice chair could eventually be elected as chair, serving as council chair would not necessarily be a requirement or a responsibility of the vice chair position. To create a vice chair position would require an amendment to the council's constitution and bylaws. Should an amendment be needed, proposed language would be developed following this meeting, and a council vote would then be held via email. Approval of an amendment to the constitution and bylaws requires a 2/3 supermajority vote of council representatives. So now you've heard from me. Now we want to hear from you, and that is, do you feel that we should move forward with an additional leadership position? And if the answer is yes, should that be a vice chair position? So let me open it up for discussion.
Ron, if I may, thank you for that overview. And I feel very strongly that it would be a wise move to make in this day and age of so many unique responsibilities that everyone has. But even more than that, I would add to the points that I shared in writing, some of which you've mentioned. I'd also mention that a person in that role could actually be a part of executive deliberations for the planning and preparation of meetings that are to be held in the future, as well as preparation for participation in national meetings. So I see the enhancement of executive deliberation as another element to this important position. And if a motion is needed, I would eventually so move.
And John, I see your hand up.
Well, not surprisingly, since I think Gary and I were the ones who sort of brought this up at the last meeting, I also support this for the very reasons Gary said, including the sort of executive consultation and thinking through of agendas and other sort of matters of the council for kind of the working group prior to these meetings. And I think I neglected to respond to an email now that I think about it, that I was invited to share some thoughts, so I apologize for that. But I do think it's a good idea. And I like your approach to sort of a vice chair, and am really comfortable with this as an option, even though maybe folks don't necessarily see the need for it at the staff level.
Great. Other thoughts?
Ron, there's a question in the chat. Erica wants to know how many times the chair is currently allowed to run for consecutive 2-year terms, and is there a limit?
I think it's 28. So there is no limit. There's at this juncture in the Constitution bylaws, there's no limit. And I said half jokingly, but Bill was chair for was it 28 years? For a while. Yeah, somewhere around there.
Mm-hmm.
So we have not told Amy that her term is the same. But yeah, there is an election every 2 years. Other questions, comments, thoughts? And Amy, if there aren't, then would you think a motion would be needed for us then to proceed into developing an amendment for the full council to vote on?
Absolutely. And I think we already had some people who are willing to make that motion. It looks like Gary, you have your hand up.
And Madam Chair, I would so move. I think it would be an important next step for us to take in the history of this renowned entity in public health.
Thank you so much, Gary. Do we have a second?
Come on, John.
I see John's hand up. I assume that's a second. All right, any discussion? All those in favor, unmute and say aye.
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 Any opposed? Any abstentions? Okay, Ron, I believe that motion passes.
Okay, so we, as a next step, we will work on developing an amendment, and then Gary and John, if the two of you will be so good as to review it prior to us sending out to the full council, that would be appreciated. Of course, Amy will have that opportunity as well.
It would be an honor to do so.
Happy to do so. And if I neglect my duties, feel free to text me or call saying, get on it.
Okay, you see, John, we were not going to say that we did not receive a response. That was fine. We thought sometimes silence can be, oh yeah, that looks fine, but sometimes it's not. I understand. So thank you both for volunteering.
Thank you. Okay, so our next agenda item, and before we actually get into the real business of the council, I did want to let you know that we have a new member, and I'm wondering if Julie Willems Van Dyke, if you can introduce yourself as a new member from FAB, that would be wonderful.
Sure, Amy, I'm happy to. Good afternoon or good morning, everyone. I am Julie Willems Van Dyke. I am your new representative from the Public Health Accreditation Board of Directors, taking the seat previously occupied by Dr. Rex Archer.
Good. How are you?
And I have spent my public health career in Wisconsin. Served many years as a local health officer in north central Wisconsin in a county, Marathon County, the Wausau area. I spent 10 years leading the County Health Rankings and Roadmaps project, and then I completed my career as the deputy secretary and part of that time also as a state health officer for the state of Wisconsin. I currently am an assistant adjunct faculty member at the Medical College of Wisconsin and failing at retirement. But I do want to tell you one quick little story about when our chairman and our president asked me to serve on the council that just made it an automatic yes. And that is when I became the health officer in Marathon County, we were working on a new performance appraisal system for our public health staff. And it was the early 2000s. And I went looking for competencies and found the Council on Linkages competencies that were published, probably the original set in 2001, and we built our performance appraisal on those initial competencies. So it feels full circle to come here. And I'm also really thrilled to see some of the changes that have been made, because I remember some of the changes you've made are some of the challenges we faced using them back in the early 2000s. So thank you all for your awesome work over the years, and I'm happy to see some familiar faces and meet new folks and serve alongside you.
Thank you. And you already preempted one of our questions about the core competencies on how you use it. So welcome. Now, are there any other new members that we don't know of that are here? I just want to make sure that. Okay, thank you. All right, now we can go on to the next item, which is our Public Health Advocacy Consensus Task Force. Just kind of as a reminder from before, during our June meeting, we were all introduced to the Public Health Advocacy Consensus Task Force, or FACT. And it's an initiative of the Lerner Center for Public Health Advocacy at the Johns Hopkins Bloomberg School of Public Health to gain consensus on the definition of public health advocacy, and also to identify the essential advocacy skills needed to operationalize it, and also draft guidance that could help schools and programs. And in the interim, all of you endorsed that. So in August 2024, that's when you all voted. And so the endorsement of FACT by the council means these items: the addition of the council logo to the consensus webpage, designating a representative from the council to serve on the FACT Advisory Council. It's about an hour per quarter time commitment, and to act in the best interest of the council as a whole, providing occasional feedback to the council, and then helping to promote the FACT consensus efforts widely. So our next step is to designate a representative for FACT Advisory Committee. And Mark, I see you, and I will recognize you after we talk about FACT. So thank you. So several council member organizations already endorsed this effort, as did the Public Health Foundation, which staffs the council. So if your organization already endorses the task force, you can still participate as the council's representative. So this is an ask, okay? So we're asking you to think about whether you would like to serve as a representative on behalf of the council to this FACT Advisory Committee. So what's going to happen is Mayela is going to send an email calling for volunteers to represent the council on the FACT Advisory Committee. And if you're interested in representing the council on this committee, or if you have questions about this position, please email Mayela at Marana, M-A-R-A-N-A, at phf.org. And individual council member organizations not already endorsing the initiative may wish to also consider adding their organizations to their list. And to learn more about the opportunity, you can visit the FACT website or email your questions again to Mayela. Mayela, I hope you get a lot of emails at Marana, M-A-R-A-N-A, at phf.org. Are there any questions about being an advisory committee representative for the council? Okay, I hope all of you are thinking as to whether you'd like to do this or not. It sounds like it's a very interesting committee. Okay, before I hand off to Ron, it looks like we do have another new representative. Mark, can you introduce yourself?
Sure, thanks for the opportunity. I'm Mark Humphrey. I am a program director for our preventive medicine residency here in Columbia, South Carolina, with Prisma Health and the University of South Carolina. And I am serving as the American College of Preventive Medicine's representative to this fine organization. So I appreciate the opportunity to be a part of your work.
Well, thank you so much, because as it turns out, you're also representing me because I belong to the American College of Preventive Medicine as well. So welcome to the council.
Thank you very much.
All right, I am now going to officially hand off again to Ron so that he can introduce our next speaker.
Great, thank you again, Amy. Well, as most of you know who've been attending council meetings, that due to the critical need to strengthen our public health workforce, this agenda item has been a standing item for the past few years. Today, we are fortunate to have with us Andrea Young, who's the director of the Division of Workforce Development in CDC's Public Health Infrastructure Center. And Andrea will be talking with us about the important work of this division in addressing public health agency workforce development needs, as well as other needs of the overall public health workforce. I've had the pleasure of working with, I guess I should say, Dr. Young. Sorry, Andrea. I've had the pleasure of working with Dr. Young for more than 20 years. In the early years of the Core Competencies for Public Health Professionals, that was probably some of the initial work. And Julie, you reminded me of that as well, that, Andrea helped us refine that initial set and advocated for the competencies within CDC. At that point in time, there really wasn't a lot of thought within CDC about whether or not there should even be core public health competencies and how those would be used. And Andrea was a big advocate for that. In addition, she played a major role in helping public health practitioners have greater access to and use of evidence. She served as Associate Director of Science and Branch Chief for the Applied Systems Research and Evaluation area within the Center for State, Tribal, Local, and Territorial Support. Everybody remember CSTLS, preceded by OSTLS, preceded by FIPO. Oh my God, I'm old. Andrea was there, really carrying that torch about the use of evidence. She also co-chaired with the National Library of Medicine, the Partners in Information Access for Public Health Workforce Initiative, or affectionately referred to as PH Partners. So without further ado, Andrea, let me turn it over to you, because I'm sure people would much rather hear from you than me. So Andrea.
Thanks, Ron. That was a really nice introduction. We have known each other for a long time, haven't we? So I'm pleased to be here today. I'm so thankful for Ron for inviting me to talk about the Division of Workforce Development's efforts to strengthen the public health workforce. Next slide. So just a little bit more about me. I'm relatively new to the role of the Director for the Division of Workforce Development. I've been in the position now for about 8 months. I'm going to take a minute before we jump into our priorities and programs and what we've got going on in the division to just quickly kind of orient you to the organization of the division. So along the bottom of the org chart, you can see we have 4 branches. Some of these faces might look familiar to you. Moving left to right, we have the Education and Training Services branch led by Gabby Benenson. This is the organization that manages CDC training collaboration with Public Health Foundation and offers 11 different types of accredited continuing education credit. And a variety of other services too, which I'll touch on a little bit more later in the presentation. Next, we have the Epidemiology and Laboratory Workforce Branch. This is the home of the Epidemic Intelligence Service, EIS, program, among other fellowships. I'm sure some of you are aware of that. And then after that, we have the Field Services Workforce Branch, which is best known for the Public Health Associate Program, PHAP, again, one of our larger flagship fellowship programs. And then finally, we have the Public Health Workforce Branch, which manages 5 different additional fellowship programs. They're a little bit smaller than EIS and PHAP, and they focus on a little bit more analytical, purely analytical, like data science, modeling. And so I'll talk a little bit about each of the fellowships as we proceed. Next slide. Here we have the division's 4 strategic focus areas. Goal area number 1 is focused on quality learning, something important to all of us. It's focused on strengthening the skills of the current workforce through quality accredited competency-based training and building a diverse public health workforce through applied fellowship programs. Our second area of focus, valuable service, is all about the services that our fellows provide at their host organizations and their participation in CDC response to domestic and international public health emergencies and needs. So some of you might be familiar, if you worked in health departments, of requesting a CDC epi aid or lab aid. It's a team that comes in and provides technical assistance to this jurisdiction experiencing a need. With goal 3, national leadership, we're focused on facilitating the use of standards and best practices for training and workforce development programs, building the evidence to address identified needs and inform practice, and fostering results-based partnerships like why I'm here today. And then finally, our 4th goal, it's internal. This is an internal facing goal focused on the division's own foundational capabilities. We have to have a strong foundational capabilities within our division to deliver the programs and services of the division. So we are focused here on making sure that we have physical accountability, management operations, communications, evaluation, those kinds of cross-cutting foundational activities. Next slide. So the division directly manages 10 different fellowship programs. Programs range from opportunities for middle and high school STEM teachers to service learning career fellowships available to individuals at the bachelor's degree level and graduate level. And these fellowships cover a broad range of cross-cutting skills and competencies, including epidemiology, evaluation, informatics, modeling, general public health practice, laboratory leadership skills, among others. In FY23, we had over 730 active fellows participating across these 10 fellowship programs. And now, though, without the COVID funding, our fellowship classes are getting smaller. So we still have some of our COVID-funded fellows still active, but they'll be rolling off throughout this year. So our class sizes will be getting smaller with the reduced funding available. For example, the PHAP class of 2022, which graduates in October, at the start of that class, it was nearly 150 individuals. The new PHAP class, which is starting in October, includes 46. So you can see we've had quite a reduction in the size. At the moment, we do not expect to increase or be able to increase the number of fellowship graduates entering our programs and then ultimately finding pathways to governmental, state, tribal, local, and territorial public health. Rather, right now we are focused on continuously improving the effectiveness of these existing pathway programs, using our evaluation results, and really working hard to ready fellows for employment in the public health system upon program completion. So for us, retention of these fellowship graduates in public health after they complete the program, getting them into public health and staying there is a big priority for us. Next slide. So equally important to recruiting and developing the next generation of public health workers through our fellowships programs is training and developing the current public health workforce. And thanks, I mentioned this before, thanks to our collaboration with Public Health Foundation, we're able to connect partners and health professionals with accredited competency-based training from CDC, other federal agencies, and federally funded partners via CDC Train. And as I think you all know, CDC is part of the Train Network, a shared learning management system available across the country to state, tribal, local, and territorial public health agency staff, healthcare providers, academia, and K-12 education providers. As part of the network, CDC courses reach nearly 4.9 million learners who use the broader Train Network to take public health trainings. This is a really important system and vehicle for us to get out competency-based training and accreditation, and appreciate the collaboration with Public Health Foundation. Next slide. So CDC Learning Connection, it's a free training promotion service that we offer to CDC programs and partner organizations. This service promotes quality trainings through a website, a newsletter with over, I think, 676,000 subscribers, social media, and other partner outreach. The CDC Learning Connection newsletter, just so you know, has the highest number of recipients among all the CDC newsletters. So it's very popular and active and has a big audience. Also, the website makes it easy for learners to get to CDC Train, define training, and get CE. And in FY23, we're still counting our FY24 stats. So I'm referring to our FY23 right now, but our FY23 CDC Learning Connection featured 33 trainings and promoted 77 additional workforce-related resources. Next slide. So our partnership with Public Health Foundation on CDC Train and other activities is a great example of how the division collaborates with partners, depends on partner organizations to serve and support the public health workforce. So here on this slide, I'm just highlighting some of our key partnerships. The CSTE Applied Epidemiology Fellowship and the Applied Public Health Informatics Fellowship. These are two programs that serve as pathways to careers in public health. The fellows are placed in state and local health departments for 2-year fellowships where they receive on-the-job training and development while serving the needs of their host organizations, which are typically health departments. And we also fund CSTE's Data Science Team Training, DSTT. This program is focused on the flip side of the coin, the upskilling of current health department staff. These data science team training teams receive just-in-time training and technical assistance tailored to their needs as they tackle real-world data science projects. So they work a real project as a team that's relevant to their organization, and then they receive technical assistance and training to help them upskill and be able to tackle the project. Our partnership with ASPPH, I'm still on this, thank you, allows us to place fellows in service learning assignments within CDC centers, institutes, and offices. And then finally, at the federal level, just wanted to highlight 2 federal to federal partnerships. We collaborate with AmeriCorps to establish the Public Health AmeriCorps program, which is now in its 3rd year. And then we also collaborate with HRSA on the Public Health Workforce Research Center, which I will dive into now a little deeper on the next slide. So as Ron mentioned, I previously had a number of science-related positions, so this particular project is warm to my heart. Our partnership with HRSA is important to our evidence-building efforts. HRSA and CDC have co-funded University of Minnesota, which includes a consortium of academic member institutes and practice-oriented partner organizations via a 5-year cooperative agreement. We refer to this as the Public Health Workforce Research Center. This cooperative agreement was first awarded in 2022. It focuses on 4 national level priorities that you see here on the slide, evaluating the role of various occupations in delivering programs, investigating the composition and size, need, and distribution of the public health workforce, assessing various workforce development methods that are focusing on like recruitment and training models, and then studying implementation of various workforce strategies and interventions. And through the Public Health Workforce Research Center, we support efforts to define and build the evidence to address public health workforce needs and guide practice. Years 1 and 2 research projects have yielded 9 peer-reviewed publications and 16 presentations at national conferences to date, and that's constantly ticking up. With the release of the Public Health Services and Systems Research Agenda earlier this year, we were able to use the domain devoted to workforce to help us align the PHWRC, or Public Health Workforce Research Center, with the national evidence building efforts. So approximately 75% of the new projects for this cooperative agreement, there are 10, will advance the public health systems and services research agenda. So we're trying to align nicely with that particular agenda moving forward. And that's all I have. That's it.
Great. Well, I welcome people to ask questions in the chat and or raise your hand, and we'll be happy to unmute. But there is a question in the chat for you, Andrea.
Okay.
And it is for the CDC Learning Connection trainings. Can you describe how partner organization is defined? In other words, can anyone use this service?
If you're a funded partner organization, you can use this service, but Gabby Benenson, the branch chief, is really the person to answer that in detail. So let me make sure that I get the right answer for you and get that right back to you, Laura. Okay.
Yeah, this is Jane Steinberg, and if you provide
Jane, okay.
Andrea, we can get it out. And as far Jane, are you referring to being able to post trainings or take trainings? So like through CDC Train, access to either through Learning Connections or directly, anybody can register and take training. Posting trainings are a little bit different. So maybe you could clarify as Andrea moves on to another question. So there is a question, and Gary will get to you after Laura. Okay.
Good.
So Laura asks, for the community-based trainings, you mentioned that they are accredited. Can you talk about what organization accredits those trainings? I'm often asked about where training programs can obtain accreditation.
Yes, so CDC is able to accredit to 11 different types of continuing education. And so to get accredited, you have to be an organization that has that accrediting capacity. And so can you clarify your question a little bit more about what you're interested in?
No, that makes sense. You
Okay.
answered my question. I know what you're talking about now. I hadn't
You're
thought of
thinking
it that way before.
Okay. Yeah.
Thank you.
Yeah.
Super. And Jane said yes to both. But taking training is a big part of it. So maybe what we can do is Mayella or Kathleen, CDC Learning Connection, CDC Train, put the URL in the chat. And Gary, let me turn it to you.
Thank you, Ron, and wonderful overview. And I'm delighted to see all of the activity that your particular part of CDC is engaged in, Andrea. A question that I have goes to the public health workforce composition element that you described in your very last slide. And I'm wondering if settings have a lot to do with that, particularly where we've seen the public health workforce affected in various settings, and I'll pick the rural setting as one. And I'm wondering if you collaborate with Diane at the new Rural Health Center, and could you just say a little bit more about that? Because I really see you being a stimulus for greater activity in the workforce across the nation.
Yeah, I appreciate that, and know Diane very well. We work closely together. She's a wonderful collaborator, and in fact, with the new research projects coming out of the Public Health Workforce Research Center, we were able to partner with Diane's office, the new Office of Rural Health at CDC, and get some additional funding. So we actually have 2 rural workforce specific research projects in the group. So normally we are only able to fund between HRSA and CDC a total of 8 research projects. But this year we've got 10, and 2 of them are devoted to rural. And then also in our collaboration with the University of Minnesota and the consortium on the proposed projects, we always try to make sure that any kind of studies that are looking at the composition always have an angle in there with regard to rural where appropriate. that's a big priority for us. And so some of our existing research that's already been published through the center have elements of rural in it in terms of characterizing that workforce or the challenges that particular workforce has. But we hope to increase that as we move forward in the coming years.
Wonderful. Thank you.
So it's the couple of complimentary comments in the chat box. Always nice to see. Great to hear of all the programs supporting middle school and high school science and CTE teachers. And then we have a graduate of the CSTE Applied Epi Fellowship Program talking about the importance of this program for state, tribal, local, and territorial health departments. And then somebody else chiming in of being having attended the CDC Science Ambassador Workshop in Seattle. And thank you, Mayella, for putting in the URLs, always appreciated. But here's another question for you, Andrea. Are the plans for the workforce development in any way informed by the results of the DuBeaumont Public Health WINS survey?
Yeah, so DuBeaumont an important partner for us, as it is as all of you as well. And so we use and rely on the DuBeaumont PHWINS survey data for a number of things. One, it is an important data set, and frequently the researchers involved in the Public Health Workforce Research Center utilize that data set or components of that data set. But then also it's an important source for us to look to when we're focusing on that part of our portfolio that's attending to the current workforce and developing the current workforce. And in fact, we're really excited about the new PHWINS survey results coming out because they've added some new elements related to the role of loan repayment in terms of recruitment and retention in the public health workforce, and we're anxiously looking to get those data. And we also think there'll be results in some of the new module data coming out with the DuBeaumont survey to help us fine-tune our recruitment and retention, our recruitment of new in, but also retention of the existing workforce. And so it's a very important data set for us.
And Andrea, if you don't mind me adding to that, your division also develops training plans. Andrea mentioned about the thousands of trainings that have been made available through CDC Train. And often what the division does is they will go through and look at what's needed based upon PHWINS, based upon Council on Linkages work, based upon the profiles of ASTO and NACCHO and NIHB and others, and see what's needed. So for instance, the division developed a training plan built upon 6 of the 8 core competency domains as an effort for initially Public Health AmeriCorps that then they took and made nationally available through CDC Train. And it provides some really good introductory and foundational training. There's also a foundational training plan as well. So I think a lot of your work, at least what I've observed, is informed by what you're hearing from the field and what the science is showing us as well.
Good addition, Ron.
Other questions for Andrea? I don't see any others, so I'd like to thank you for being with us today, for contributing, and for all of the work that CDC is doing, and also for being a big fan of the council for 20 years or so. The work that we do, especially on competencies. You mentioned public health systems and services research. I mean, that was something that before there was PHSR, we as a council worked on that, developed the research agenda. Hugh Tilson had led that effort. I see Paul Halverson. Paul, when you were at Ostiltz, I think you were very involved with that as well. So again, Andrea, thank you so much. And Amy, let me turn it back to you.
Absolutely, and I'm going to turn it right over to somebody whose screen has appeared, Kathleen Amos, because she knows everything about the core competencies. So Kathleen, can you update us on the core competencies?
Well, I can give it a try. Hi, everyone. It's great to see you and hear you this afternoon, or I guess this morning, depending on where you are. We wanted to share a little bit of an update about the core competencies and have some discussion around that initiative of the Council on Linkages. If you want to go to the next slide, Mela. Y'all have seen this before and y'all have heard this before as well, but we always like to just start with a quick reminder about the core competencies for anyone who's less familiar with them. So the core competencies for public health professionals, or core competencies as we call them, are a set of competencies that are designed to reflect foundational or cross-cutting knowledge and skills for all people working in public health. So whether you're working in public health practice, education, or research, this competency set hopefully has something relevant for you and in terms of the skills and knowledge that you need to do that work. You can see the various iterations of the core competencies on the slide here. And I think Julie mentioned earlier, the core competencies have been around for more than 20 years now. They first came out in 2001, although they were predated by a set of universal competencies. And we have had several revisions over the time period since 2001. So the core competencies were revised in 2010, 2014, and then again in 2021 with that current version that we're using now adopted in October of 2021. And these competencies are really used in workforce development activities across the country, as you'll see on this slide here, particularly widely used by governmental public health agencies at the state, tribal, and local levels, and used throughout the sort of span continuum of workforce development activities, from job descriptions and performance objectives, through training, workforce development planning, all that sort of stuff. The core competencies also appear in major national initiatives, so you've seen these before, but initiatives focusing on things like education, continuing education, workforce development planning, so help providing some support in all of those areas. And then on the next slide, we talk at every council meeting about how we provide TA and we track the TA that's provided, technical assistance, excuse me, that's provided to give us a sense of what people are using the core competencies for, and what kinds of questions are coming up as they're doing that. So we do keep track of all of this, and to kind of take a step back and reflect as we set the context for the discussion that we'll have today. We went back and looked at all the technical assistance that we've provided related to the core competencies since the 2021 version was released, again in October of that year. And we also, you all know, we track the stats for web stats related to the core competencies in terms of how much usage there is. So we have both of those to share with you today. So in terms of technical assistance, over the last 3 years, just about 3 years now, we've responded to more than 100 requests for assistance using the core competencies, serving organizations in 69 organizations in 29 states, the District of Columbia, and 5 other countries. So Canada, China, Tanzania, the United Arab Emirates, and the United Kingdom. In addition, the core competencies have been accessed online nearly 100,000 times, with an additional 100,000 visits to the resources and tools that have been developed to help people implement the competency set. We can go to just the next slide. I think there's a screenshot here of some of the resources and tools that we do have available. We developed, as we do with every version of the core competencies, we've developed numerous tools and resources as well as delivered numerous trainings, presentations, workshops, that sort of stuff, to raise awareness about the core competencies and assist public health professionals and organizations in using them for their workforce development. We also regularly provide expertise to help others with the development and implementation of competency sets, particularly those that use the core competencies as part of the foundation for their discipline-specific competency sets. So, for example, the Council of State and Territorial Epidemiologists supplied epidemiology competencies. The Association of Public Health Laboratories has a set of laboratory competencies. The Council of Public Health Nursing Organizations has a set of community public health nursing competencies, all of which have used the core competencies in some way in their development and implementation. And we also provide that expertise based on the experience that we have with developing and maintaining this competency set. So, for example, we've had several conversations with Canada, the Public Health Agency of Canada, as they've been looking to revise their set of core competencies. And then I think on the next slide, I'm going to turn this over to Amy to lead us through a bit of a discussion about how the core competencies are being used, how you all are using the core competencies, and then talk a little bit about the review cycle, the review process that we go through with the core competencies.
Thank you, Kathleen, so much for your updates. It's always amazing to me at how many people, and also the people around the world, who are using these core competencies. So as Kathleen said, I do want to ask you how you are all using the core competencies, but I'm also interested with the latest iteration, with the 2021 iteration of the core competencies, just a little bit of your feedback in terms of those 2021 as kind of a segue to our next topic as well. So how you're using the 2021 competencies, and, if thumbs up or thumbs down on, how you're doing with those 2021, the latest iteration of these competencies. So you can either raise your hand or put your answer in the chat. And so we just want to find out how you are now using these core competencies.
I can share a little bit about how we're using the core competencies in Montana.
Oh, that'd be wonderful. Thank you.
So we are using them a few different ways. I'm out of the Office of Public Health System Improvement, specifically workforce development. So we are in the process of developing leadership development programs for our internal staff, and then eventually rolling it out to our 60 decentralized local and tribal health departments. And so we're actually using the core competencies to help develop the leadership programming. And so making sure that all of the supervisor trainings are aligned with FAB and the core competencies as we're building those, making sure that they're, that's kind of our curriculum and our standards as I go through and develop, what books are we going to use to supplement? And then our workforce development plan for our division and the state was written, using the core competencies as well. So we have alignment all the way throughout, and then using the core competencies as like our pre-assessment and evaluation to where they think they're at with their leadership skills, their communication skills, their program management skills. And then we'll use the core competencies in those assessments as we monitor their progress through those things. So that's kind of just one small way we're using it, but making sure that, every training that we've been putting out is aligned with the CDC quality standards, FAB, and the core competencies, so that there's alignment regardless of what we're doing.
Wow, thank you so much, Kayla. Can you tell us how this latest 2021 version, is it consistent with your needs, or are you finding elements lacking, or what do you think about this 2021 version?
The hardest thing for me personally, as the person who went through the core competencies, was and this is really like nuanced and minor, but all of the different synonyms for leadership. Like I said, like it's super minor, it's a minor inconvenience, but like supervisor, leadership, advocacy, there's so many different nuanced ways to say the same thing. And so that was a little bit tricky in terms of the consistent language that was being used throughout when we were trying to build a program based off the core competencies. It was a little bit difficult for me in terms of like, well, this is referring to a supervisor versus a leader. So what might that look like in our program? And so that, you know, like very, very minor in terms of what I was using it for this way. And so that was, like I said, it was very nuanced. And I will say, like, at the advocacy piece, there could have been a little bit more. We're putting more of an emphasis, especially with our local and tribal health departments, on how to advocate for their health departments when it comes to like their county commissioners and their board of health. And how do we kind of prop them up and help support those pieces too? And that's an intimidating thing for them, especially when they're a health department of one. How do you stand up to your county commissioner, who is also maybe the person who owns the grocery store in town and they own, you know, half of the town? How do you stand up and advocate for more money for your health department? And so that was another thing that we're working on developing as well, that wasn't as clearly defined for us. So
Thank you so much. That's interesting feedback.
Yeah. and
Okay, I'm
Amy,
sorry, go ahead.
Do you mind if I just chime in on the advocacy? piece?
Absolutely.
That's, I mean, perfect that we're now engaged with the FACT initiative, which is to have more advocacy in public health that will lead into competencies. And one of the reasons why they initially approached us when they started the initiative was because the core competencies do have advocacy in them. And it's really like the only set at the time that had that. So it'll be interesting to see what comes out of that initiative, and that could inform the process down the road. Sorry, Amy.
No, that's okay. It's interesting to hear that background. And in the chat, Marita says, in addition to the references in FAB standards and measures, FAB recently released a workforce plan template, which was updated from an Ohio State University template for health departments where the 2021 core competencies are referenced. So thank you for that, Marita. And then John, did you want to say something about this? But you're saying that states are using them in various ways. Did you want to come on camera and say something?
So, you know, states are using these in workforce development plans, thinking about what they should be focusing on, especially I think as it relates to the foundational capabilities and crosswalking some of those, and then using them in job descriptions for language that can be, I think, clear around skill sets needed, et cetera. I don't, you know, and I haven't, I don't have information because I didn't think to talk to ASTO about this before, so I'm kind of trying to represent ASTO as best I can on whether or not the changes since 2021 are being used any differently. And there are others on the phone or on the call that know that. They should feel free to speak up.
Thank you.
Yeah, I sure saw Sharon from Kentucky. Are you still here? Oh, maybe not.
I'm here.
Yay.
Sharon. Oops, I just muted myself. Kentucky was one of the big advocates for changing the competencies to the 2021 version. David Knapp in particular, as we recall. Just any of your thoughts about their use within Kentucky?
Well, I know, Ron, you know, we are still in our infancy stages of our newest assessment for our workforce. And David Knapp was, of course, our guru for our competency leadership. And I know he was a big proponent for the changes that have been made. So we're happy that we're finally able to move on with what we are currently working on with your all's help, Sonia. And we just completed our assessment and looking forward to seeing what those results are. So kind of not ready to be able to tell you how well things are going to be working in that area just yet, but I'm excited, very excited to see what our results come out here in the next week or two.
Thank you, Sharon.
And Sarah from Toledo. Hey, Sarah. So they're using core competencies for their job descriptions, and one of their universities uses them as a guide for what students need to complete during the internship. Sarah, did you want to say anything more about that?
Just that it's really helps standardize and really make our job descriptions a little bit more robust so that we have more people applying. They know exactly what they're applying to and what is expected of them when they start. We have also started to use those in our internship position descriptions so that the students know when they apply that we'll be able to help them complete their requirements for their program in order to graduate.
Oh, that sounds great. And then it looks like Dan, unfortunately, Dan had to leave. So he says that core competencies are one of a number of sources of information for AUPHAs, body of knowledge, and which are going to be updated again. The public health, community health, and population health domain specifically, and in other domains like professionalism, IPE, etc., across the total of 25 domains. An important point is the content, not the competencies, however, since the healthcare management programs are housed across public health, business, health sciences, public health administration, and even nursing schools and colleges. Wow. Okay. And Chandley, did you want to say anything about your comment running career services for MPH and MS programs in Dartmouth?
We really use them as the anchor for discussions with students about their career exploration and development and thinking about how they represent their skills in their resumes. And also thinking, one of the things that we did this summer is we sat down as a core MPH education team and looked at our curriculum by which skills students would develop for specific competencies related to our coursework. And then we put together a roadmap for them. So we said, basically, if you're looking for a job that requires policy development and program planning, these are the courses that you want to make sure you take.
Oh, wow. Nice use in academia, which is where I'm from. Thank you. I see, Erin, you have your hand up. Erin, what did you, and then I'll get back to the chat.
Sure, Amy. So I'm Erin Seedorf, and I actually work with Dan as representative for
super.
the. No
Thank
problem.
You.
I just thought I'd very quickly just try to collapse that information a tad, just to really highlight the aspect that the way that we've used the competencies is in building that body of knowledge. The body of knowledge, you know, and Dan mentions is used across all of the different partnering agencies around the health care or health administration fields, right? And we do that field also has an accrediting piece. I'm not entirely sure that those two accrediting, I mean, I know that the body of knowledge speaks to the accrediting that goes on through AUPHA and its partnering organization. But as it really says here, it informs the body of knowledge that then our partnering organizations who teach public health aspects in their health management or health administration programs then apply. So it really has informed that information that our programs use. Is that helpful?
Yes, thank you so much.
No problem, no problem.
Okay, and it looks like we have a comment from Kristen using them to survey target training needs and gaps for all 12 tribal epicenter staff across the country. Kristen, did you want to say anything more about that? That's exciting. Kristen, are you on? Does anybody else have any knowledge of how the core competencies are being used?
Well, Amy, let me add two more.
Oh, okay, sure.
And this is from a previous Council on Linkages meeting where they presented, but we have Missouri went through a prioritization process, a gap analysis, built it into the workforce development plan, are now working on implementing that plan to address workforce needs. And then we have Milwaukee, who did something similar, but what they also did was they added in the racial justice competencies in their prioritization process, and we were able to demonstrate how you can use those two sets of competencies together. And so that was helpful. And I know there are others, they're just not coming off the top of my head.
Wow.
And of course, CSTE used the core competencies as one of the competency sets in developing their new set of competencies that they talked about last council meeting.
Kathleen, do you have all that? Thank you so much. Well, this kind of is a segue to our core competencies review cycle. So every 3 years, and I can't believe it's been about 3 years already. We were just discussing that the other day. The Council on Linkages, we have to discuss the timing for updating the core competencies to ensure that the core competencies reflect the evolving public health workforce roles, responsibilities, and functions. And as the most recent version of the core competencies was reviewed and approved by all of you in October 2021, as you can see that it's being used extensively in local, tribal, state areas, many different places. And it sounds like the feedback is pretty positive regarding the current version of the core competencies. We're hearing that they're simpler to use, the language is a little clearer, and the topical issues more important to public health are being addressed. And as you've heard, they've been worked into competency sets like the newly revised applied epidemiology competencies that we've heard about several times from the Council of State and Territorial Epidemiologists and what Ron just referred to. So we've also previously received requests to consider lengthening the review and revision cycle for the core competencies to minimize the disruption and allow time for organizations and individuals to integrate the latest core competencies into their work before revisions are made. And as we've heard from the discussion, it sounds like the organizations are using them, but maybe not a lot of feedback on, oh, this needs to be changed or that needs to be changed, or just kind of getting their feet wet in terms of, you know, here are the new topical areas and just getting them integrated into workforce plans and assessments and other activities. So with the broad use of the core competencies and acknowledgement that the current concepts and needs are integrated into the 2021 version, and also the requests to extend the time period for revising the core competencies, we were thinking that the time probably isn't right to start talking about revising them again. So it should be noted that it's decision not to begin review and the revision process at the present time doesn't mean that the council must wait another 3 years before revisiting this question again, since we can really do this at any time. So at this time, just asking for feedback in terms of, you know, should we revise? It has been 3 years, but should we revise at this time, or should we wait a little bit and just wait for these new set, the 2021 revisions, which were pretty extensive? Should we allow them to sink in, or just what are your thoughts about that? Yes, Julie.
being a relatively new member of the council, I'll just throw this out based on our current experience at FAB. Having made a fairly significant change in our standards and measures in 2022, as we look forward to our version 2027, we are looking at not doing a complete overhaul of standards and measures, but rather looking at tweaking things that we have found need some improvement, and really focusing on processes related to the standards and measures rather than the content of the standards and measures. So I think there's some similarity there. And I think the other thing that could be very similar from FAB's experience and the council's experience is you know, we're just seeing people starting to use the version 2022 standards and measures. And so the timeline for people actually having experience with it is longer than the publish date. And so I think, again, and especially in light of the world we've all lived in 2021, we were still definitely in the middle of the pandemic and the recovery from the pandemic. It makes sense to me to think that we would extend that review period.
Thank you. And it looks like Laura Racer-King from the Council on Education for Public Health is agreeing. So it's 3 years, really a short time for adoption. Maybe 5 years could be a little more realistic. And she agrees with you, Julie, tweaking about every 5 years and overhaul every 10. Terry, you have your hand up?
Yes, thank you, Amy. Yeah, I would also agree. I think extend it and see how things continue to roll out. Amy, and you certainly know this, you led the effort and
one half.
as you know, one half, well. And we made significant changes, I think, and really updated them, and also changed the format so it's more workable. And yeah, I think it's way too soon to go back and redo again and should extend it. I think it's just being used now, and it's and people are getting used to the new format, you know, and so I agree. Let's extend it.
Thank you so much, Terry. Let's hear from Paul, and then we'll go over back to the chat.
Yeah. So again, I don't want to disagree, but I will. I think the reality is that whenever you're a standard setting agency or organization, as we are to a certain extent, you essentially have a responsibility, in my view, to sort of help lead the field. And when you freeze things in time, you actually can be accused, I think, accurately, of slowing down progress. The world's changed. Just think about public health today, post-pandemic, as compared to pre-pandemic. And so I think the issue is it takes a lot of time to make revisions. I get that. And there's nothing magic about every 3 years. Maybe it is 5 years, but I do think it's really important that we be committed to this continuous process of updating. And again, we may choose to update sort of in a minor change or a major one, depending upon the change. But I think a major part of our responsibility is making sure that we actually are leading the field and not simply being a boat anchor to the world that has changed. So, yes, we can essentially choose to make a minor modification or say we're going to go to 5 years instead of 3 years. It's a lot of work for sure, but I think that's sort of our core responsibility. And the last thing I would say is also thinking about ways in which to be synergistic with other instruments. And I do think this is one of the great advantages of the work that we do as the Council of Linkages, is thinking through ways in which to actually do this linkage. And it may have already been done, so forgive me if that's the case. But Ron, I'm thinking about the most recent work with the National Board of Public Health Examiners, as they just completed the job task analysis, asking thousands of people working in public health, what are the things that you do every day? What are the competencies necessary for you to do your job well? And it seems to me that would be great input into the Council on Linkages competencies. And if that crosswalk hasn't been done, to use Liza Corso, she's so great about talking about crosswalks, but it just seems to me that that's another touch point, if you will, as we think about the development and revision of our work, because I think that's the most recent work that's been done as it relates to looking at contemporary job task analysis. So with that, I'll go back to being quiet. Thanks.
Ron, I assume this is in response to Paul's statement.
It is, and also I was looking at what John put in and thinking about others. So a couple of thoughts. One is the review and revision process typically takes about a year, because we do a good bit of getting feedback from the field. Kathleen, 20 some odd town halls, virtual town halls. It's really important to hear from the field. Secondly, I have had discussions with Paul Kunert about the FAB process for making revisions, and the two of us started talking about, are there things we could do together to get feedback at the same time that could then be used for both purposes? And so that is another possibility. And Paul, what you talked about with National Board of Public Health Examiners, that's another piece. So even if we don't immediately work on revising, we can be and should be collecting the information like the MBPHE information that exists so that we are ready to move forward. There was one other thing to consider too is the council does permit the changing of EGs within the competency. That doesn't require a formal vote from the council. So sometimes to adjust to new needs and emerging needs and future anticipated needs, some of the examples can change to help the field and move things forward. We did put in more this last go around on climate change and racial justice and anti-racism, advocacy, etc. So I think, yes, I agree. It is important for us to move things forward as well as to be responsive to what we're hearing from the field. And that was a long way of saying that I agree with a lot of what's being said.
Yeah, and also John suggested maybe staggering revisions with FAB as well. And Kayla, you have your hand up.
The one thing that after listening to everyone talk, I used to be a teacher, and so I think of these as like a set of curriculum or standards. And the one thing that I saw time and time again is like new curriculum or new standards getting rolled out so often that teachers or like professionals can't understand and fully buy in. And I feel like at the ground level, at least here in Montana, and granted, Montana's always about 10 years behind everybody, right? Like we're still just in the early 2000s with like our Walkmans, right? But my point being that like there's finally some weight behind the core competencies. And so if they all of a sudden are changing so rapidly that people aren't keeping up, it's going to become more of a burden and less of a guiding force. And like research shows, at least with educational curriculum, it takes 2 to 3 years for a curriculum to be fully implemented and successful, and for you to start to see that ROI. Like, so you're seeing that progress being fully developed. So for this, if you're thinking about it from that same lens of a curriculum and a set of standards, it's still that 2 to 3 year cycle. And so you're at the end of that. And so we're just now starting to see all of the positive outcomes because of these new core competencies. And so if they start to change, we're not going to see that full extent of what the 2021 competencies may have had. And I just think if they start to change so rapidly that public health professionals can't keep up, they're just going to toss them aside altogether because they're inundated. They're learning so many new things so constantly. And so if we're, if that makes sense. And so collecting data, tweaking as we go, but if they're getting an overhaul so frequently, people are just gonna kind of ignore them and tap out versus use them in everything that they do.
Thank you. And just from the comments, it looks like people are agreeing with not making major changes, like you were saying, Kayla, or maybe just tweaking a little bit. There's some agreement about maybe collaborating with FAB. And it looks like there's some support for that. And also, again, liking the idea of doing some planning with FAB as well. So, and agreement with what Kayla just said. John, go ahead.
Yeah, so I think if we're interested in doing this planning, that will take time to like work with these organizations and actually think through the plan. So it's something that if we're serious about that, I think needs to start now and could be part of our work plan.
Thank you. I'm seeing some nods from the staff. And then Joe says the FDA food code is officially updated every 4 years with minor updates every 2 years. So kind of like what some of the others were saying as well. Thank you so much for this discussion. I'm looking at the time and it looks like we have to go on to the next agenda item. I think Kathleen's probably taken extensive notes and will take back all these considerations. And you provided some really, really great suggestions. So thank you so much. At this time, I'd like to move on to the next agenda item, and Bill Keck gets to talk, not as chair this time, but he's going to talk about a really exciting development, and that is his book. So, oh no, actually he's going to start off with the academic health department discussion and learning community activities, and then he'll talk about his book. Bill?
I think you're stuck with me for a minute first, Amy.
Oh, all right. Kathleen, you start.
I will start us off with a little bit of an update on the learning community, the HD Academic Health Department learning community, and where we are with that. So again, if we want to go to the next slide, similar to the core competencies, this is not new, but for those of you who are joining us for the first time or for others who are less familiar, the Academic Health Department, or AHD Learning Community, is a national community that brings together and supports practitioners, educators, researchers, and others to explore this idea of an AHD partnership, or a formal partnership between a health department and an academic institution. So this community is really designed to be peer sharing, for members to share their experiences and engage in collaborative learning. We have been operating this learning community since 2011, so it's been quite a few years at this point. We currently have about 1,500 members from health departments, academic institutions, and other organizations across the country. And we offer these members resources and activities to help them support them in developing and sustaining academic health department partnerships. So this includes things like sharing examples and stories of these types of partnerships, so people can see successes and what that looks like. We have a regular webinar series that often features success stories. We build resources, like, for example, probably our most popular is a collection of partnership agreements that organizations have used to formalize their connections with each other. Just provide some examples for others who are interested in doing the same thing. And we have a listserv as well for people to ask questions amongst the community members. We also offer technical assistance, so we'll get you some expert help with your questions if that's what will be useful. And the next slide, we just wanted to highlight a couple of events. So we do regularly share expertise that has been developed within the learning community around AHD partnerships. At essentially whatever we're invited to, whether it's national, regional, local, all different kinds of events. Partly to help build awareness and knowledge of this concept, educational purposes, and partly to really just to help people dig in and operationalize some of this and highlight the value that it offers to both health departments and academic institutions. So one event that we had the privilege of participating in recently that was really exciting, a little bit different than some of the other stuff that we've done, was the Tennessee Department of Health's Academic Practice Linkages Symposium, which was held this summer, where they brought representatives of the state health department together with representatives from academic institutions across the state to really explore how they might partner and work together. And so we were able to participate in that event, provide a little bit of an introduction to what an AHD partnership is and why you might want to engage in that way to help frame some of the discussion. We are also currently in the process of preparing presentations for the 2024 Public Health Learning Forum, as well as the American Public Health Association annual meeting, both of which are in October and both of which you'll hear more about a little bit later in this meeting. And then on the next slide, we wanted to just mention a few things related to webinars, because webinars really also play a significant role in our educational offerings as well. So the council has been running a series of AHD webinars pretty close to the length of time that the learning community has been around, so more than 10 years now. And we also participate in webinars in collaboration with other organizations, again, as we're invited to do so. So we are currently in the process of making a collection of archived webinars. So all of the webinars that we have done through our AHD webinar series are online, as well as accessible through the Train Learning Network. So Andrea talked earlier about CDC Train. National Train contains these webinars, but they're all sort of one at a time. So we're working on building a training plan on the Train Learning Network that will just bring all of these together into one spot. So you'll have one easy place to go if you're on Train and looking to view those webinars. So we will share updates about that as it becomes available. We anticipate in the next month or so that should be finished. We also just wanted to mention, again, a great big thank you to Andrea and her team for inviting us to do a virtual seminar for CDC staff. So we will be doing that next week. It's hard to believe it's next week already. But we're working with members of the AHD learning community from both the Massachusetts Department of Public Health as well as the Toledo-Lucas County Health Department in Ohio to put together this seminar for CDC staff in the infrastructure center on AHD partnerships and how they contribute to health department capacity. And on the next slide, I have one more update, again, just related to providing technical assistance and how that's going over time. This obviously is not as far back as what we looked at for the core competencies discussion. So this map just shows technical assistance requests that we've filled since the last council meeting in June. So since then, we've responded to 8 requests from 7 organizations in 5 different states, the District of Columbia, as well as in Kenya. And we're also beginning to apply this expertise related to HD partnerships that has been developed again through the HD learning community over the last decade in more in-depth technical assistance engagements. So, for example, we're working kind of our first such engagement is underway right now, and we're working with the local health department to do an environmental scan, do some interviews that will help lay the groundwork for building their HD partnership. So we're really excited about that work and that opportunity to kind of dig in a little bit deeper, get a little bit more involved than simply, you know, answering the question here and there sort of thing. So that is what we're up to through the learning community at the moment. And Bill is going to share our most exciting new adventure right now.
Oh, there it is. Yes, thank you, Kathleen. Well, I think you all know that a major reason for the existence of the Council on Linkages was to respond to the finding of the 1988 IOM study committee that public health practice was largely disconnected from its academic base. So the council has been supportive of partnerships between public health practice agencies and academic institutions and other settings from its beginnings for well over 30 years now. But it was about 13, 14 years ago that Ron and Kathleen and I were quite frankly, not real happy with the progress that was being made in that area. So we decided that we would push it with the academic health department learning community, and more recently with the able assistance of Mayela, Arana, and Grace Davis. And as you've all been hearing, most of you at least are familiar with hearing reports from Kathleen or me about what's been happening with the learning community and how it's grown to well over 1,500 members now, and all of the activities that you've heard about. We've also learned a lot and developed resources and tools that we make available to people. But it seemed to us that maybe since we were getting a lot of questions, there seemed to be a growing interest in the field in this area, and that we were sort of the keepers of this information. And quite frankly, I think Ron and Kathleen were also concerned that it might be good if we could broaden that a little bit and add to the resources and tools available by bringing together what we've learned about how you form, how you manage, how you grow, etc., academic health department partnerships. So it became our COVID-19 pandemic project. And we actually then have now put a book together, and I've just received the proof copies from the publisher. So I'm really happy to say that this book, which in many ways is sort of a how-to manual, an expanded how-to manual, because it contains not only how you might think about academia and practice working together, but there are the frequently asked questions are there with their answers, the things that Kathleen hears most about over the phone. We have 6 case studies of quite different and examples for people to look at. We have a chapter by Paul Irwin and his colleagues on what's known about academic health departments, the research and what we have yet to learn, and so on. So we think we hope, let's put it that way, we hope it will be helpful to people. So I have just gotten the first proof copies, and I think Ron and Kathleen's just arrived today. So we actually have proof copies in our hand from the publisher, which means that we're within several weeks of the book being available for sale. So we will, I think, through the good offices of the Public Health Foundation and the Council, let everybody know when the book is available and how it can be ordered. The price, I think, is going to be $24.95, I understand from the publisher. So it's a little under about $25 for this book. So that's the update. If anyone has questions, I'll try to respond to them, but we're really happy to have this project pretty much in the can.
Any questions for Bill? Well, Bill, this is really, really exciting. Thank you so much. And I know Kathleen and Ron, you're behind this too, because it looks like your names are on the book. Thank you so much.
Indeed.
I think we can go on to our next item, which is on retention and recruitment learning community. And Mayala, can you get us started on this one?
Absolutely. Thank you so much, Amy. Great. So just as a reminder, this new retention and recruitment learning community was an initiative that was approved earlier this year during the March Council on Linkages meeting. So we are continuing to work towards the establishment of the retention and recruitment learning community that will meet the need that we've been hearing from our partners and others in the field. And so the goal of the learning community is to foster collaboration and provide an environment for sharing effective strategies for retention and recruitment, as well as highlighting successes and working through some common challenges. As you know, the AHD learning community has been around for quite some time, so we're kind of working in a similar fashion to when the AHD learning community was established. And so this is just another avenue for the Council on Linkages to support health departments and other public health agencies in meeting their workforce needs. So this group is being chaired by Terry Brandenburg, who is the NACCHO representative to the Council, and the retention and recruitment work group that was established to help us really kind of think through how we're refining and defining the goals and the objectives, activities of the learning community has grown to over 70 members now that have all volunteered, from health departments to academic institutions and various other public health organizations. And they're really helping us to ensure that the purpose and the goals of the learning community are in alignment with the needs of the field and will really help to maximize the benefit of the learning community. So this work group has really been a really vital partner in helping to shape the learning community's activities and the impact that we hope to have. I think, Terry, I will turn it to you to talk a little bit about the successes that we've had so far.
Yeah, sure. Well, I mentioned we had over 70 volunteers in a work group, which was totally amazing. And I think a couple of things when you think about that number. First of all, it really represents the need out there in terms of retention recruitment, especially with our governmental public health agencies. A lot of interest. Secondly, it brings at the start of this initiative, it brings a lot of knowledge and experience into it. So I think it bodes very well as we get ready to launch this new community. So our work group met 3 times over the summer and completed our charge and made significant progress in the development of the community, including articulation of the purpose. Spent a lot of time on why are we here and what's our vision for this. But we also ended up identifying initially 5 focus areas. And these are not carved in stone, and certainly I expect they will evolve over time. But initially, our focuses will be organizational culture, workplace environment, and employee experience, professional development, human resource policies and processes, academic health department partnerships, we just talked about those, and workforce pathways and recruitment. Now, additionally, we're also considering potential learning community activities. Now, these could include, as you see, they could be webinars, podcasts, blog posts, social media engagement, development of tools and resources, and interactive storytelling. Now, throughout the process and beginning even before the formal establishment of the learning community, or it's the work group developing it, council staff, we're not starting from time zero, okay? Council staff have been collecting strategies, tips, and resources for supporting workforce retention and recruitment. So I think we have a really good start. Now, with the support and direction of the work group, these strategies, tips, resources are currently being transformed into a retention and recruitment toolkit that will be made available on the council website, providing a valuable starting resource for the learning community and others addressing retention and recruitment for the public health workforce. Now, in terms of the launch or the initiation, we're planning for the launch and operation of the learning community continues. The decision will be made to move the launch. A decision has been made to move the launch to November to be sure that there's funding to fully implement and continue the effort. Additional details about the launch will be shared with future council meetings when they're available. Now, while the learning community still is under development, we have been highlighting retention and recruitment tools and resources at national conferences, which I think we're going to be taking up in the next agenda item. So, Myla?
Yes, thank you so much, Terry. So I'm happy to take any questions at this time about the retention and recruitment learning community.
Any questions for Myla?
Wonderful. So as always, more information about the retention and recruitment learning community and the work group can be found through the retention and recruitment learning community section of the council website, or by sending me an email to marana@phf.org.
Excellent. Thank you so much, Myla. Next, we have a section on very exciting upcoming conferences.
Thank you.
Yeah.
Wonderful. Yes, so the council regularly presents at national conferences and other meetings to share the workforce development resources that the council offers and to support public health professionals and the organizations that also use the resources that we develop. So this fall, the council initiatives will be highlighted at a handful of conferences. So we'll be talking a little bit about the Open Forum Next Generation, which is in a couple days. But we'll also be talking about the Public Health Learning Forum, Workforce Development in Action, and the American Public Health Association's annual meeting and expo. So just Open Forum will be taking place in Chicago, Illinois later this week. Open Forum focuses on developing the current and the future public health workforce to meet the ever-evolving needs of the fields. This conference is hosted by the National Network of Public Health Institutes, and this year will showcase emerging practices and innovations related to public health infrastructure, the public health workforce, complex public health challenges, and topics related to performance management and quality improvement. So council staff will join Open Forum to present a breakfast roundtable on Thursday morning, retention and recruitment in governmental public health. So we are very excited to be in Chicago later this week talking about the new learning community and the tools and resources that we are kind of pulling together for this toolkit. So we're very excited about that. And then later in October, the Public Health Foundation will host the 2024 Public Health Learning Forum virtually on October 15th to the 18th. This year's theme is Workforce Development in Action, and sessions will focus on training and tools to support public health workforce development and building governmental public health workforce capacity. So we'll have, you'll see on the next slide, topics will include the academic health department partnerships, the core competencies for public health professionals, as well as fostering diversity, equity, inclusion, and justice, and a handful of more. So I think I'm gonna show you our schedule at a glance for the Public Health Learning Forum. And just mention that registration for the Public Health Learning Forum is free and available through the Train Learning Network. You can register at any time, and I can find that link right now and drop it into the chat for you all as well. But yeah, Kathleen, I'll turn it to you to add anything about the Learning Forum.
Sure. Yeah, thank you. We are really excited about this event. We've been planning it for months and months and months, so we are very excited to get it underway. So as you can see on the slide here, we do have 8 sessions over the course of those four days, all in the afternoon Eastern time. So hopefully that will work with schedules across the country. Everything is virtual, running it through Zoom. And there will be, as you can probably tell, although maybe not entirely, from some of the sessions, some of the titles you see on the screen, there'll be a number of sessions focused on academic health department partnerships, or on the core competencies for public health professionals, or that include those as part of their highlights. So for example, the very first session, the opening session, will be a collaboration with the Kentucky Department for Public Health, and highlight some of the work that they've been doing in workforce development, some of the work that Sharon just mentioned related to the core competencies for public health professionals. And that session will be led by Dr. Stephen Stack, who is the current ASTO president. So we're very lucky to have him joining us for that. We'll also have content related to the core competencies, et cetera, in that intro to public health workforce development session that afternoon. As well as in sessions later on. You can see on Friday afternoon, we have a session also that highlights the core competencies in the Trained Learning Network. And then our academic health department focus session is on Thursday. It's the first session of the afternoon on Thursday, October 17th. So we are very much looking forward to this. We hope you can join us. As Mayella mentioned, it is free. Just log into Train and you can register. And then on the next slide, it's not quite the last slide, it's almost the last slide. We want to just give a few more details about the APHA annual meeting. So again, this meeting, as many of you know, I'm sure, will be at the end of October, the 27th through the 30th. It's in Minneapolis this year. And this year's theme is focused on building trust in public health science. So the event will offer innovative and exciting opportunities to help attendees engage with public health experts, collaborate with other advocates, and grow professionally. And I'm sure Milo is, put it in the chat box as we speak. So we have 2 sessions in which the council will be engaged at APHA's annual meeting. So first on Sunday from 2:30 to 4 p.m., we'll host the annual Council on Linkages session. Every year, APHA has been kind enough to reserve a time slot for Council on Linkages programming, and we really appreciate that and owe them a great big thank you every year for doing that for us. But we'll have a 90-minute session that we can focus on whatever we like to related to the Council on Linkages. So this year, as Mayella and Tara were just talking about, we've decided to focus on the newest of the Council on Linkages initiatives. So looking at how we can support retention and recruitment of the public health workforce. So what's the Council on Linkages role in that area, and what should we be working on? So that's going to be on Sunday afternoon, right after, I think, the opening welcome session. And then on Monday morning, we are participating in a academic health department roundtable session. So this session is being hosted by the Academic and Practice Linkages in Public Health Caucus, which is a collaboration of the Association of Schools and Programs of Public Health, excuse me, the Public Health Accreditation Board, and the Public Health Foundation. So the 3 of us co-sponsor this caucus. At this session, we will have about 10, it's either 10 or 11, I can't remember, but about 10 roundtables on different topics related to AHD partnerships. So there should be a good mix of different types of content if you're interested in learning more about those partnerships. So that is an overview of where we are headed for the next several months as we wind up the conference season for the year. And we hope you can join us at any or all of these events. We're happy to see you there. Does anyone have any questions about any of these? I think we put the links for all 3 of the conferences in the chat, so there is more information online. And Joe, I'm very excited that you are super excited for the upcoming events.
Questions for Kathleen or Myella?
True.
That's a lot of presenting.
Yeah. Yeah.
Wow.
Feel like we got the spring and then the fall. You got your 2, everything happens at once.
Yeah. Okay, I guess we can go on to the next part of the agenda, which is, does anybody have any other business for this meeting? And if not, our next steps is to, well, we have to schedule another meeting. So the next meeting is not yet scheduled. Myella is probably going to be sending us a link on when we can schedule. And we will love to see you at the next meeting, of course. Thank you so much for participating in this meeting. We're going to take all of the notes that have been collected and get back with you at our next meeting with these next steps. Again, reminders to get back with us. For example, if you want to be our representative to the FACT, the Advocacy Committee, and if you need any other information as well. So thank you all so much. And Myella, for your information, we are adjourning, what, about 9 or 8 minutes before your allotted time. So
So does that mean you get 9 or 8 minutes next time that you can go over?
No,
of course, it's cumulative.
8 or 9 minutes left for Ron to fill. No, but seriously, we will look forward to seeing you all again next time. I think Mel and I were chatting this morning or early this afternoon. This is our last meeting for the year. So we wish you all a good fall and holiday season and all of that. And we are looking to, over the next couple months, to get scheduling polls and stuff out to get ready for 2025.
And
Thank
maybe
you,
see you at
Amy.
APHA or conferences.
Thank you all.
Thank you.